Welcome back. We'll continue our discussion with Britain's top fertility specialist, Dr. Dr.Taranissi. Dr. Taranissi, you tend to implant multiple embryos. Isn't there a risk attached to that?
Well, I don't, because at the end of the day, there are rules and regulations. There's a maximum number that you can use to implant in any person, and
Yes.
particularly in this country.
Yes.
I mean, it's more sort of relaxed in places like the States and so on. But here, you cannot put more than 2 embryos in women below the age of 40, and a maximum of 3 embryos
yeah.
above the age of 40. So we've never done more than that. For us, it's a very tricky situation, because I know the HFE are trying to push for single embryo transfer and stuff like that, meaning that you only should put
Yes.
1 embryo. It's not a law, but it's just a way of trying to reduce the number of multiple births and so on. This is very difficult to apply in our cases, because most of our patients have come to us having failed many times. Some of them even 10 times, 12 times before they come to us.
Yes.
So how can you actually convince any patient, having had, let's say, 5 failed attempts, every time she has between 2 and 3 embryos put back, minimum 10 embryos have been put in her before,
Yes.
and she never got pregnant. And then we will say to her, by the way, we just want to put 1 embryo in you. I mean, there's no way anybody will accept that.
Yes.
Particularly when it's such an expensive treatment and you've paid thousands of pounds for it. And we put 2 embryos back in those patients, which is, any doctor who's got any kind of experience will tell you this is the right medical decision. The fact that they may end up with twins is not my mistake.
Yeah.
You probably need to go and ask whoever was treating her for 5 or 6 times why she never got pregnant before.
But they probably prefer to have twins, because the chances of them getting pregnant again are slim.
People, it's not the doom and gloom that is sometimes portrayed for political reasons, if I'm very honest about it. I think you can handle. The problem with multiple pregnancy, yes, there is a higher risk of certain problems and so on. But when people actually present this to you, I would say it's a little bit misleading, because to say there is an increased risk of X, all right, without explaining, sounds really ominous. But if you look at what is this increased risk, so if the risk is, let's say, 0.2%, and then it becomes like 0.4%, yes, it has increased, but you're still talking about a very, very small, minute risk. Do you know what I mean? So you need to explain those kind of things so that people can understand. All what they tell you, there is a 2-fold increase or 3-fold increase. So on the face of it, it's like really worrying. But if the initial risk is very small, even if you double it or triple it, it's still not that much anyway. Plus, most of the problem, or the serious problem in multiple pregnancies, particularly with twin pregnancy, are the problems that originate from a single embryo that divides into 2.
Yes.
These are the ones that can have a lot of complications and problems. And this is not the kind of multiple pregnancy that you get from IVF. The multiple pregnancies that you get from IVF are from 2 separate embryos most of the time. Most of the time. And with good monitoring and with good advice and so on, and with huge advances that happen now in baby care and stuff like that, I mean, it is manageable.
What are the side effects of IVF? There are side effects.
I mean, the one that can happen during treatment is if people over-respond to the drugs.
Yes.
I mean, this could be quite serious if it happens. And
you mean the overstimulation of ovaries?
Yeah. It can happen sometimes, but in our experience, this is very rare, because the way we monitor people and we see them on a daily basis and we adjust the doses and so on, it's kind of almost non-existent in our practice. And I think generally speaking, because a lot of people have now changed the way they do things, and they also do more blood tests and they maybe scan people more often and so on, it's on the decline. But I would say 5 years ago, it was a serious issue. And most clinics used to have at least 1 or 2 patients every couple of weeks, or some of them go to the hospital and so on. Well, it could be potentially a life-threatening condition, but in reality, people can just be in the hospital for a day or 2 or 3. And
it's also very painful, Dr. Taranissi. I believe one of your patients did end up in hospital when her ovaries started they were stimulating and hyperactive.
No, actually, it's very rare in our setup. And most people, if they have this, it can be classified into various levels. I mean, there's mild hyperstimulation, moderate, and severe. Particularly people who do get pregnant, because the hormone of the pregnancy can actually do like a flare up of the symptoms and so on. So it's, I mean, it's the ovaries are very big. They stay big for a number of weeks. If people are not drinking lots of fluids and they're well hydrated, if they're not really having enough pain relief and so on, some people sometimes cannot cope with it. But it's not something that will kill people or anything. Yeah, it can, but I mean, that's very rare. That's very, very, very rare. Didn't happen anyway
not
with
people,
us anyway.
women.
Yeah.
Dr. Taranissi, can the overstimulation of the ovaries cause ovarian cancer in the long run?
I mean, in theory, this was one of the issues that was causing concern and so on, but most of the studies that have looked significantly into this didn't really show a real risk of that. I think what it might do is maybe accelerate a process that would have happened anyway. It's like if somebody was having ovarian cancer or whatever, but going through IVF might speed up the process and it may come a few years earlier. That's my theory anyway.
So you mean the ones who get it after IVF, they're probably just prone to it and IVF,
That's what I think. But I mean, you have to remember that IVF has been around now for 34 years almost.
Yes.
4 million babies have been born as a result of that. How many millions of women had this? So if ovarian cancer was an issue, by now it should have been very clear, but it's not the case.
Is it true that the long-term side effects of the IVF drugs that are being used these days, they're not yet known?
I wouldn't go as far as that, because when you talk about, again, a procedure that has been around for over 30 years, lots of studies, lots of research has been done into this field. Nothing has been shown to say that, okay, these drugs are going to be harmful in a significant way for the women that have used them. And you have to remember that most people will not do IVF like 10, 20 times. I mean, most people will do it once, twice, 3 times. That's the vast majority of people.
But how many times can a woman go through an IVF cycle?
In theory, you can do as many as you want, but...
Seriously? I mean, you take all those drugs over and over again. That must be damaging.
It must be, but as I said, in theory, yes, you can do this if you want.
But how many times would you advise a woman to go through IVF before you say cut-off point?
I think with us, if we cannot get sort of the couple success within 2 or 3 attempts maximum, then with us, I don't think it's going to happen. Do you know what I mean? Because sometimes the treatment itself will identify a few problems that would have not been clearer before, and then you take this on board the next time you change something, you modify an approach or whatever, then you hope that next time you can do better. But
Dr. Taranissi, how do you tell a couple, I'm afraid it's not going to happen?
Well, I think you need...
Because you're being practical, but how do you deliver it?
No, but it's not my decision. I mean, my role and my sort of responsibility towards the couple is actually to put the medical facts to them in an easy way to understand, and tell them from our experience what we believe can be done and what cannot be done. It's always the couple's decision. And I can tell you endless stories. I mean, I remember one lady came to us. I think she had something like 13 or 14 attempts or something like that. And then she had 1 treatment with us. She didn't do particularly well and she wasn't pregnant. And then she disappeared for about a year because she used to come from overseas. And she came back the following summer, having already done another 4 or 5.
Oh, God.
So she was on her like 19th attempt and 2nd attempt with us. And I sat with her and I told her, okay, based on this, and this is what we can change, this is what we cannot change. She was sort of early 40s. Chances are pretty slim now. And she said, but I want to try with you because I've only had 1 attempt with you and all the rest of it. And she had a boy.
Really?
And, yeah, in this cycle. I remember when her husband came, and to know about the result on the day of the pregnancy result.
Yeah.
When the girls told him that she was pregnant.
On her 19th?
Yeah.
Overall, 19th
Overall, yeah,
attempt.
yeah. There was no reaction whatsoever because he wasn't expecting this. He's just used to go for this visit and be told negative and come back. So there was no reaction. It took him about 3 days to think.
To register.
Yeah. And
It's
then they
happened.
came and they were like really very this and very that and so on. I can tell you endless stories about things that we have seen over the years and so on. And sometimes things are not as simple as like 1 + 1 = 2.
Yeah.
And you need always to allow for this unknown factor.
Dr. Taranissi, obviously your clinic is extremely busy. While it's very professional and very efficient, you know what's coming? You're smiling. Some people complain that it does not offer the right emotional support. And it's very regimented, it's almost like, cattle in a farm.
No, I don't think this is true. And I'm not being kind of like defensive or anything like that.
So why can't you give more TLC at your clinic?
I don't know. I mean, I'm not quite sure we don't, but I think in any setup, anywhere in the world, in any field, there will always be some people where you cannot sort of really, I don't know, there will always be a little bit of complaint somewhere.
But I think people who come, who can't conceive, they're obviously in a very emotionally vulnerable state.
But that's why you need to look at how much of that is also emotional, how much of that is because of other things and so on, rather than actually what actually happens in reality and what's been said or not said or whatever. And you have to accept that and as part of the service. And you shouldn't really overreact to it or also disregard it completely. I mean, obviously there are times and situations.
But speaking like obviously on behalf of a patient,
Yeah.
I can sometimes understand when you go to a doctor and even if the prognosis is negative, but they actually smile at you and say, don't worry, everything will be okay. It's just when a doctor says that you just feel so much more better about it.
I think as far as I can tell, I mean, obviously because I don't see every single patient every time, so I can't really just tell you, but I know the general consensus is to try and be as accommodating as possible, as friendly as possible, understanding that some people sometimes may behave in something that is not the normal way of doing things because of the situation they're in and so on, and you need to be able to accommodate this and accept it and handle it and deal with it. But
so maybe
no
a pretty
system is
nurse
perfect.
who smiles a lot in the future?
I think we've got a lot of them. They're really very friendly. Yeah, they are. They are, as far as I'm aware. Anyway.
What are the reasons for the growing number of for the growing number of couples who are infertile?
I don't know whether there is an environmental sort of possibilities as well, because a lot of the things that we eat and consume and so on can add to this in people who are predisposed.
You mean modified food?
Yeah, there are all sorts of theories about that, and the way even the food is packaged and all sorts of things. And this is probably more of an issue with male infertility. That's always been a connection between this and male infertility and stuff like that. I think there is also a possibility that a lot of people are now aware of the chances of being offered treatment and stuff like that, whereas before people sometimes used just to accept it and there was no treatment to offer them anyway, so they just live with it. People now come forward and they ask for medication and for treatment and I don't know, maybe it's a combination of all of this, that you're more kind of aware of fertility problems as a whole, and it's always an emotional subject that is covered widely in the media whenever there is a new treatment or a story or something.
You've known to work 7 days a week, 365 days a year. In 2007, your estimated wealth was £38 million.
Yeah, well, that's 5 years ago.
That's 5 years ago. What's the number now?
It must be more. I don't know.
Do you know how much more? But.
Yeah.
And you don't take vacations.
Yeah.
What drives you to work this hard?
I don't know. I've always worked like this, even when I was a junior doctor. It's just the way I am. It's not something that I really miss, that I didn't go on a...
But does that not impact your personal life? I mean, you have 5 children.
Yeah.
Clearly, fertility is not an issue.
Yeah.
And but you've been absent from the family life in large. How do they feel about your dedication to your craft?
I don't know. I think you have to ask them. But I mean, I guess it's something that I try not to think too much about it, because
But everybody needs a break.
I know, but I don't feel I need what most people recognize as a break, like to go on holiday or something like that, because...
The last time you went somewhere was in 2002 in Chicago.
Yes,
and
that's
that too
right.
on a work-related trip.
That's right, that's right, that's right. But as I said to you, I mean, I don't...
Are they supportive, your family?
I think they are very supportive. I mean, I guess, I mean, I
find
don't
it
know
so
what I
hard to
can
believe,
do about
Dr.
it.
Taranissi.
No. It's just, as I said to you, I try not to think too much about it, because I'm not quite sure at this time of my life I can really change that much. I'm just the way I am, and this is how I am. And
You did start taking Saturdays off for a few hours because your father was unwell.
Yeah, well, this was in 2010. I
Yes.
used to spend a little bit of time. Even that, I mean, retrospectively, I feel very guilty about it, because...
Seriously?
Yeah, I do. No, not because I spent time with him.
Okay.
That I should have spent more time with him.
Yes.
That's how it plays on my mind, because although he never asked me, and he wasn't in this country, I mean, he lived back in Egypt, and when he was very ill, we had to fly him by air ambulance to here, and he was in intensive care for like 2 months and so on, and most people have given up on him, and they said, okay, we need to switch off the machine and all the rest of it. But he sort of came out of this, and he was here for about a year. And
was he proud of you?
I think he was, but I just feel I could have done more. I could have spent maybe I don't know, maybe more time with him, but I didn't.
But would you want to spend more time with the family in the future? You have 5 children.
I know, but my eldest daughter is 29, so I don't think she'll
youngest is what, 12?
Yeah, she's 11.
11, yes.
Yeah. Well, I mean,
And you know, daughters do need their daddies, just the way patients need their doctors.
Yeah, I guess you're right, but I don't know. I just don't know what to do. I don't really know how I can change that. I mean, I think I just work in one way. I don't really know any other way.
Because it's a punishing regime every day, 365 days a year.
I don't see it like this. But what would you do if you're not working? You're gonna just sit on the beach or something and
go to
talk
the park, play with your kids. One of your children plays the instrument.
Yeah, he does, and I've never actually sort of been once to listen to him.
I know that.
I know, but anyway, I'm sure you will understand.
Well, we'll see.
It's all right.
Should IVF, Dr. Taranissi, be available on the NHS?
I've always said yes. If it's possible, then it should be, because most of the time it's an indication of an underlying medical problem. And I know people talk about priorities and with shortage of money and so on, whether IVF should be high on the list. It should be on the list. Where on the list, that's another discussion and another debate, but I don't think it should be out of the list.
Because at the moment, only people who are rich and wealthy can afford IVF.
Yeah.
Because a lot of insurance companies don't cover IVF
It's never
treatment.
been covered in here by insurance.
Well, in America, some insurance companies do cover, but
Yeah.
so if you don't have money, you don't have the right to have children?
I don't agree with that. I mean, I've always said that it should be something that is covered by the NHS. It should be. And covered with no limitations. Because some sort of trust and so on, they can offer you treatment, but under certain conditions that you can only have, I don't know, like day 2 transfer of the embryos, you cannot have frozen embryos. There are all sorts of restrictions which shouldn't be the case. If you're going to sponsor people to have treatment, then you give them the full sponsorship so that whoever is treating them will give them the maximum chance. But you cannot cut corners. You may as well not sponsor them, because it's a money wasted. It's why should you? Either you do things properly and get value for money, or just don't do it. It's as simple as that.
Dr. Taranissi, science is in the business of pushing back the frontiers of knowledge. There's a very fine line between what's ethical and what's not in your field. In your opinion, what's not ethical?
I mean, to put it in very simple words, I mean, I've always felt uncomfortable with, although I never try and preach people to believe in my way, but I've always felt uncomfortable with things like egg donation and sperm donation and things like that. It is obviously possible medically, and it's not against the law, it's not against the practice in most countries, but it's something that I personally always felt uncomfortable with.
What about gender selection?
Similar things, but maybe to a lesser degree, because although we don't do it, you're not allowed to do it in this country anyway, unless it's for a medical reason.
Okay.
Like if there is a certain sex that can sort of have a certain medical problem, then you choose the sex for that, but not just for family.
In your opinion, should the medical community be allowed on a global level to practice gender selection? Because it can be done.
No, it shouldn't be done. Because medicine, in my view, is about helping people who've got medical problems and medical conditions and stuff like that. This is not a medical condition to choose a boy or a girl or whatever. That's. I mean, I think in my mind, you should be grateful for having a healthy child, whether it's a boy or a girl or whatever. That's not where medicine should interfere. That's my view, and it's always been my view anyway.
Dr. Taranissi, people spend so much money on IVF. And emotionally, it takes a toll on you with all the hormones being injected and so on and so forth, and then the disappointments if it doesn't work.
Yeah.
With so many orphans around the world, why don't these couples want to adopt?
I don't know, but that's a personal choice. I mean, you cannot force it on people. Some people feel comfortable with it, other people feel uncomfortable with it, and so on. It's not as simple as that. And it will never be the same as well. I mean, having your own genetic child will always be different from adopting or even going for egg donation or embryo donation or things like that, which can still give you a child at the end of it, but it's not the same. And the perception of people of all these things is not just about a child at any cost. There are other things that come with it as well.
But you just said that you feel that egg donation, embryo donation is like pushing the ethical boundary.
In my view, I mean,
I don't know, of course, it's your view.
Yeah.
But if a woman was to come to you and she doesn't have a partner, yet say she's 40 and wants to have a child, would you use a donor sperm and help her have a baby?
We provide the service. We do provide the service, and we've got clinicians in the clinic who are comfortable with that, and if they're happy to do it, that's fine by me. But if you ask me my personal opinion, I will feel differently.
Dr. Taranissi, what's the future for IVF?
Well, I think the future for IVF lies essentially in something that it's called stem cell research, which is basically using the cells that can be derived from an embryo at a very early stage of development. These stem cells can be modified to develop into almost anything in the body, and this can actually change the face of medicine as we know it. So effectively you can, I don't know, develop hearts, kidneys, all sorts of things. You can treat people who's diabetes, with neurological problems, Parkinson, all these things. So that's a very fascinating field.
So basically we should warn the HFEA that Dr. Taranissi has some plans in mind.
We've looked at this way back in 2004 and 2005, and we did a lot of initial work with people in Chicago, but I guess it's not going to be for me now, because I think I'm kind of coming to the end of my career, and I don't know how long I'm going to be still working.
I think you have quite a few years left. It's not really the end.
Well, you never know.
Do you feel, Dr. Taranissi, that you've played God?
No, I never think like this. Never, ever. That's not something that ever
But
crossed
there
my
is a
mind.
power to what you
No,
do.
no. I mean, I've
You
always,
create life form.
I don't create life. I mean, it's God who creates life. I mean, we are just tools to try and help people achieving what God wants them to achieve. That's my view. And everyone in this life has been brought for a reason, with maybe a little bit of skills in an area, and you need to use the skills that have been given to you by God in the best possible way. But it's not coming from you. Whoever gave you the skills can take them away from you anytime.
Yes.
Anytime. And everything has got a beginning and an end. Nothing lasts forever for anybody. And I think people need to remember this. So you shouldn't really be big-headed about anything. And I mean, some people sometimes come to us and they get pregnant, and I really, really don't know what we did for them to become pregnant. It's just like it's meant to be. So,
Miracle maker.
well, I don't know. I really, honestly, I never really think about it
Taranissi, you're
along
very
those
humble.
lines.
But Dr. Taranissi, thank you so much. But before you go, we have a very short round that's called "What's on Your Mind,"
All right.
and I will. It's very fun and
Okay.
easygoing. So don't worry.
I'm not worried.
No questions on the HFEA.
I don't worry about this.
I'll ask you to give you two choices. You have to
Sure.
pick one.
Okay.
Yin or yang?
Ink,
Yin. Ice cream or tiramisu?
tiramisu,
Blondes or brunettes?
brunette.
Commando or long johns?
What's that?
You know, long johns are the long shorts you wear, and commando means
Oh,
you're not
right.
very much at all.
No, I don't know about that.
You are working 365 days a year, clearly.
Yeah. Well, I wouldn't know. I mean,
Well, would I, if you're not free-spirited, would I say long johns then?
okay.
Okay. A vegan or a carnivore?
Probably carnivore.
Marilyn Monroe or Grace Kelly?
Grace Kelly.
Vodka or scotch?
I don't know either. I never drink anyway.
Really?
Yeah, I never.
You work 365 days a year and you don't drink alcohol?
No, I don't. I never drank.
Beach bum or culture vulture?
Maybe the second one.
Because you haven't really gone to the beach, have you?
Yes.
Philanthropy or corporate culture?
Philanthropy.
Angelina Jolie or Princess Di?
Or maybe Angelina Jolie.
Oh. Thank you so much,
Oh, it's a pleasure.
Dr. Taranissi. You're such a joy to interview. Before we go, is there any one message you would like to give just the people at large who are battling with infertility? Anything you would like to share with them?
I mean, all what I would say is, I mean, obviously people are entitled to follow the dreams and try and achieve a family and all the rest of it. And as long as they do everything they can, whatever happens at the end of it shouldn't really disappoint them, because as a human nature, you always concentrate on the things that you cannot get. And you lose sight of a lot of good things that you have that you don't think about. And that's what I say to people sometimes. Okay, maybe it's not going to happen, or you didn't achieve what you want to achieve this cycle, but you've got health, you've got a successful job, you've got a family, you've got this, you've got that. A lot of people will envy you for that. And you probably don't think about any of this. You only think about the fact that, okay, you haven't been successful in having a child so far. The same applies to people who've got a lot of children. And they just take it for granted because it happens so easily, and they're probably just so upset, but because they cannot get a better job or a little bit more money, or they cannot go on holiday. It's just the way human nature is. And people need to try and put things into sort of its real context. Then they can handle situations better. And most of the time, if you understand that and you take it easy and relax, as long as you're actually working to achieve what you want to achieve, you're more likely to succeed than fail.
Thank you so much, Dr. Taranissi.
No, it's a pleasure.
I have so enjoyed this interview.
That's all right.
it was very informative. Thank you so much.
It's a pleasure. Thank you.
You're doing a service to the community at large.
Well, thank you
really
very much.
appreciate it. Thank you so much.
No, it's a pleasure.
Thank you.
It's a pleasure. Thank you.
Thank you so much.
Thank you.